You may not need this podcast, but I promise you're in the right place. I'm your host, Ben McDougal, with my AI companion and co-host, BenBot. Each week, we're live in the Pour Over Publishing studio to chat with remarkable students, entrepreneurs, intrapreneurs, and community builders. Together, we have fun exploring the frontiers of entrepreneurship and technology in Iowa and beyond. If you're a curious leader thirsty enough to make a ruckus, welcome to a friendly jolt brewed to keep you building. Enjoy! The awesome thing about community is that it allows us to embrace and support people in ways we couldn't as individuals. My friends, I'm in the studio with Corey Lewis, and I literally just read his shirt. What's up, dude?
Ben, I appreciate you. I'm doing well. How are you?
Dude, I love having conversations with remarkable people like yourself and IRL on the mic with a fellow podcaster, no less.
Yes.
Dude, let's open things up by giving our listeners a short introduction to who Corey Lewis is.
Yeah, so I am a husband, I'm a father of two. And I am someone that just appreciates community and serving others. So, and I do that now through my podcast and through the work I do as a clinical health coach at a federally qualified health center, working with our population there.
Today, we're going to talk about health equity, as well as how to start a podcast. You've got deep insight on both of these fronts.
Yeah.
I mean, this guy has 3 different podcasts that allow you to listen in to insight on a variety of different fronts. The Healthy Project, My City, My Health, which also is supported by events nationwide. And then Coffee Can't Fix Everything, a new initiative from Corey. So we'll talk more about those initiatives here. But before we do, my friend, what's a question you love to ask?
The question that I love to ask is something I ask in every podcast episode is, what wakes you up in the morning? And you can learn a lot about someone by how they answer that question. Like what gets you up in the morning? And some people say it's their kids. Some people say it's the work they do, but it allows me to kind of understand who I'm speaking with, and that's something that I even do in my own work as a health coach. But with working with people, what wakes you up in the morning is a question that I love to ask.
I feel like when you hear a lot of responses, it probably gives you a menu to select as you wake up in the morning, like, okay, mine usually works, but I'm going to snag Kate's, or I'm going to snag, someone else's. Yeah.
Well, you just never know what people are doing. You know what I mean? And what wakes them up, what gets them excited for the day, it's really asking, what's your why? What gets you excited about the day? And what I've noticed too about that question, Ben, is some people don't even there are a lot of people who don't even think about what wakes them up in the morning. And then it gets them thinking like, man, what does excite me? You know what I mean? And sometimes that's a good question to ask yourself. And sometimes it's a come to Jesus conversation. like
the whole show is the actual answer. Well, when I think about asking folks questions and the variety of responses, what a gift, to hear so many different perspectives. And I'm curious, when you think about yourself and people asking you questions, what's a question you don't get asked enough?
A question which is funny being in the space that I'm in, is why am I in the space that I'm in? No one really questions why I go so hard for health equity, why I switched my podcast. Because funny story, my podcast when I first started wasn't the Healthy Project. It was called the Smart Talk Podcast. Specific, measurable, attainable, realistic, and right on time health and wellness conversations.
It's like you've said that once.
I've said it. I practiced it a few times before I came today, just so I could make sure I did it real smooth. But it was a health and wellness podcast.
Sure.
So, but no one really knows the genesis of why that started. And I never really get asked that question.
Well, here's your chance, boss. Tell us the origin story.
Yeah. So when I started podcasting, it was like, oh man, it was a 3-year. It would be really cool to start a podcast. It was just really, really fun.
You thought about that for 3 years.
3 years.
Wow.
3 years. And then it's funny, I would start, like I remember going to the public library because they had a studio with a microphone, garage band, and I was just going to go in there and start talking about health. And I was like,
Ooh, subscribe me up.
I know. And just, it never went anywhere until a friend of mine pushed me like, hey, I'll be your first guest if you start it. And this was like 3 years later. This was, during the pandemic, 2020. And then there were some things that were happening with my mother's health back in Illinois, where I'm from, that really triggered me to be like, I don't really care to talk about the benefits of the ketogenic diet. I just don't care anymore. And that was scary because I was kind of building a buzz with Smart Talk. At the same time, it was like I was building this buzz, but it wasn't my why anymore. Mm-hmm. So waking up every morning was the frustration of how my mom was treated within the healthcare system, having to move her to Des Moines to get better healthcare, to live with me, to hearing other stories. Then going to work and hearing stories about people not having, working with people who couldn't afford your basic things you should be able to afford. And it was like, I just don't care about what I was talking about before. And it wasn't a gradual like, hey, I'm going to start talking about something. It was ketogenic diet. The next episode was culture and healthcare. Like it was a quick name change, everything, and I just had to make that change.
Yeah. Well, my guess is that it's not like you quit caring. You just found something that you were immediately more interested, passionate, and dedicated to. So
yes.
Okay. So as you make that transition, let's talk a little bit about health equity, right? Let's translate that for our listeners just so that we have a shared understanding of what we're talking about.
Yeah, so when we're talking about health equity, to make it simple, it's the right for everyone, no matter where they're at, socioeconomic status, whatever, to have good health care, right? So no matter if you live, under the poverty line, whether you're affluent, you get the appropriate health care. What we know about health equity, though, is it's not just your ability to go to the hospital and get great care. There are so many layers to that. It's, where you work, play, and live, right? Those social determinants of health play a huge role in how equitable your health care is. If you don't have transportation, you can't get to the hospital. If you don't make a decent living, you can't get fresh fruits and vegetables. So health equity on paper is like, just, equal health care for all. Well, there's more to it.
The complexity of this topic makes it impossible to put down on paper.
Yes.
I mean, the one example you described had 5 different dots that would be slightly different based off the people we're talking about.
Yes.
So how do you talk about, let alone serve and make an impact, when there is so many different cases, different types of stories, different situations you're trying to work with?
I had somebody on my podcast. That's a great question. I had somebody on my podcast a few months ago, and he explained no matter where you work, no matter what your profession, you are in public health. So what he meant by that was, I'm a clinical health coach. I help people with understanding health education, helping them understand their diabetes, hypertension. That is my lane in this health equity space. Yours, Ben, may be helping somebody who doesn't have a lot of means, educating them on how they can start a business, where they can improve their life, right? Everybody has a role. So if we all have that mindset, we can improve the health of some. You can improve somebody's health just by giving them a few gems. Like, hey, Get an LLC, do this, blah blah blah, XYZ.
I like
Something,
this.
something you tell somebody every day just because of who you are. Right.
Right. Well, inviting everyone to participate,
Yes.
like solves is the wrong word, but like it meets the complexity because everyone's involved.
Right.
Interesting.
Absolutely.
Interesting. And not feeling like you have to be a healthcare professional to be a part of someone's health, because the reality is the definition you just shared talks about things that aren't in the clinic, right?
Yes.
That
Yeah.
are much more outside in their daily life.
Yes. I might get this number wrong, so people can fact check me if they want, but 20% of healthcare is in the hospital. Only 20%, right? Everything else happens before you even get to that clinic. So that's how much money you make. Where transportation's a huge one. If you can't even, you know what I mean? And we're in, food deserts, the food apartheids. These things are real, and everybody plays a big part in making sure that we all can stay healthy.
You mentioned some stories when you shared your example of mom needing to come over to live a little closer in the healthiest state in the United States here in Iowa. We were talking about before this show. I'm curious. Let's hear a couple of common examples, and then let's contrast that with some very unique ones so that we can at least get a sense of the differences between some of these cases.
Yeah. So I'll give you an example of a patient that I was seeing. This was a few years ago. So I was seeing a patient, they're pre-diabetic, and they were seeing me because they didn't want to get on medication. They were almost there. They didn't want to start taking any type of medication to control their diabetes. So she was doing really, really well until there was one day she's in my office, and by this point had been seeing her for almost a year, not exactly a year, but we've been
a long time.
Yeah. And but this one time in my office, she was just not herself. Like she was just standoffish, not rude, but you can just tell her mind was elsewhere. So we finished talking, and I'm like, "Hey, what's up? Like, how are you doing? Like, what, you good? Kind of like, just trying to."
We don't need to talk about why you're the normal here. Let's actually see where you're at right now, because something's off. Yeah.
And she tells me, well, my husband lost his job, and I'm trying to figure out how I'm going to pay rent next month, right? So that goes into that whole health equity piece we were talking about earlier. She can't focus on her health because she's trying to focus on keeping a roof over her head. And I can't blame her. You know what I mean? So in that scenario, there is a social platform called findhelp.org. You go to findhelp.org, you put in your zip code, and it gives you all the social support services that are in your area. So I was able to find her a rent assistance program here in Des Moines. Gave her the number, person to talk to, gave it to her, and the relief that is like, oh my gosh, thank you.
Which isn't like, this isn't the point, but like also activated her to want to fight her diabetes with you even harder because the trust has new layers.
Yes. And even I don't see her anymore for coaching, but I'll still see her in the clinic because her provider is in the same clinic, and she'll still come give me a hug, give me an update on how she's doing. I'm still not on, my diabetes is doing really well. Still not on medication. Excellent. I lost 5 pounds, or I'm still exercising. You can just tell she's so grateful for that little bit of help I was able to give her. Well, it was a little bit for me, but it was a huge help for her.
Right.
You know what I mean? So that's just one example. And the other example is my mom, right? Like older individuals like my mother don't ask a lot of questions of their provider. They just go, like the provider tells them something and they go with it. So my mom's diabetic, high blood pressure. You name a chronic disease, my mom probably has it or knows it very well, right? She wasn't getting diabetic eye exams. So diabetics get a certain eye exam. She wasn't getting those. We brought her here. The doctor told me, Corey, I should have seen your mom 5 years ago. she had to get shots in her eyes to get the swelling down. She was going to go blind, right? And that's something little as a provider should know to give a diabetic eye exams, right? I'm not a doctor, and I know that. You know what I mean?
Mm-hmm.
Then her new primary care provider was like, hey, when's the last time you had a breast exam? She was like, 2007. What? We should get a breast exam.
Sure.
Got a breast exam, found breast cancer, right? So, but my mom being like, well, I've never questioned it because there wasn't breast cancer in our family. And my provider, whenever they would ask me, I would just say, no, thank you. They wouldn't tell me why it was important. So if they're not telling me it's important, I was just going about my business.
Yeah, you don't know what you don't know.
You don't know what you don't know.
When you're sitting in that clinic, every yes feels like it's expensive. And so I can imagine if you're not told the value of something, that it's a pretty easy no.
Yes. Yeah. So, and there's already that mistrust in the healthcare system, especially in the Black community. And that, if it wasn't for the fact that I'm in the healthcare system and there are people that I trusted, my mom probably would have never gone back to the hospital. You know what I mean?
Yeah.
So just those little things can make a huge, huge impact. Just those little questions.
Those are both interesting examples that I think should make us all curious and activate the interest in like supporting what you can do in that complex environment. One of the fun things to take a peek at is the difference between simplicity, complicated, and complex. Look at the difference between those three things sometime, and you'll appreciate the words, I think, a little bit more. I learned a lot about those differences in the book Think Again by Adam Grant. And so when we talk about complex adaptive systems through the lens of entrepreneurial ecosystems, or when we're talking about health equity and the health systems being complex, know that there's differences between things that are simple, complicated, and complex. And I'll let you enjoy the research along the way. We're in the studio with Corey Lewis, a longtime friend of mine. We met way back in the days of I don't even know when, but early days of 1 Million Cups, my friend. It's awesome to have you here. Before we go to the break, what's on your mind?
No, I was going to say we connected before that, but I'll tell you the story later.
All right, when we come back, the origin story of Ben and Corey, coming soon. Are you looking for that next keynote speaker? Maybe it's a workshop or something to add energy into your conference. Perhaps you're an educator looking to engage and activate students. Hey, my name is Ben McDougal, and if you jump over to benmcdougal.com and hit the speaker page, you'll find a variety of different talks that were brewed to resonate with students, entrepreneurs, and intrapreneurs so that together we can continue building what's next. All right, back to the show. All right. Corey and I have been laughing for the last 45 minutes. Hopefully you enjoyed that short break. But dude, the origin story of you and I was actually before 1 Million Cups started pouring coffee every Wednesday. It was just a LinkedIn message,
It was a LinkedIn message. So back in the day, I had an entrepreneurial mindset before I was an entrepreneur. And I was just trying to get tapped in to the entrepreneurial community the best way I could. And I go on LinkedIn. At the time, I was trying to start a corporate wellness company app. And I just typed in, I don't even remember what I typed in, but your name came up and I saw something about gaming. And my app was a gamification of corporate wellness. And I sent you a message like, hey, I have this app. I think you can help me. Something. I don't remember. It was something. And you just wrote back like, I don't know how I can help, but let's get coffee.
Yes.
And this was like 2011, somewhere. It was a while back, but it was
awesome.
So funny. It's funny now.
I know. Well, I'm thankful that I've been consistent since day one.
Yeah.
I don't need a motivation to gather and see what happens.
No.
I'm glad you showed that initiative, and it's been fun watching you continue to make a ruckus by supporting different conversations in so many different ways. You know, as you heard before, this guy has like 3 different podcasts that are cousins of each other. You know, there's definitely a vibe that is shared. But when you talk about starting a podcast, I mean, we were talking about the fact that people have touched base with you asking if they could host your show, let alone how to start a podcast. What are some ways of doing this? And so I think as listeners, there's probably some curiosity around, okay, I've got something to share.
Yeah.
You know, I've got an audience that I'd seek to serve. What are some things that come to mind when people are asking you how to start a podcast?
It's funny because the thing that I usually tell everybody, which is, podcasting is easy and hard at the same time.
It's easy to start. It's hard to maintain.
It's easy to start. It's hard to maintain. And the biggest thing is I tell people, start and get at least 10 episodes under your belt, right? Just start talking and get 10 episodes, because the first 10 are going to be hard. But I feel like a lot of people see where my podcast is now, where I have great mics, great social clips, but they didn't see how it started, right? And where I didn't have a great mic. But everybody wants to start with the great mic and the great audio. But with technology now, you don't have to. You can there are so many tools now that you can use to get started. It's just getting an idea, having a conversation, and just posting it. Just post it. And I think people get stuck with, needing the right equipment.
Equipment's the easy part. It really is. It's a one-click purchase, and now you have everything you need. And that can mean using your phone and something very low budget. It can also mean, spending $500 to $2,000, and now you've got a full studio.
Yeah, my first mic I purchased off Facebook Marketplace from a crackhead.
What was that podcast?
My first podcast mic.
No, I'm saying what was the podcast of the person you bought the equipment from?
It was for Smart Talk. It was my
really?
first.
Nice.
It was an audio. I still use it to this day for my home office. Audio Technica.
There you go.
They had it for $80. I said I got $40. They're like, okay, really? I'm like, okay. Met them at a sketchy gas station. And I'm like, you guys do not use this mic. This is stolen.
Equipment is easy. Well, as you think about it, and Corey mentioned it, thinking about the theme of your show, who your audience is, try not to be everything to everyone. I think some focus is important, but also recognizing that it will evolve, and trying to get too uptight about how long this is going to be in this exact theme will be misguided and slow you down. And so and I know I've done this for this show, thinking of this work as a season of creativity versus the next big venture or something that has to go big in order for me to feed my family.
Yeah, what can be intimidating is that there are a lot of podcasts out there. There are so many. But if you stick to your lane and you stick to what you're passionate about, you can make a lot of noise just within your lane. There are I'm technically in the medicine category for the Healthy Project. And you go to the medicine category, there are a lot of big podcasts, but I stick to my lane, and I was able to get top 200 in U.S. medicine category at 182, right? With nothing fancy.
How many episodes were you at when that was achieved?
Man, this was probably my second year. I don't know exactly what episode it was, but it was, I was always trending in you're top 200 in Australia or whatever. And it was okay, that's cool. But when I was 200, I got an email because I got everything linked. It was you're top 200 in the U.S. medicine category. I'm like, whoa. And then the next one was 182. And I was like, oh, okay. Now it's big time. So you best believe whenever I reach out to a guest, I say I was 182 in the U.S. medicine category.
Nice. Well, and shifting to some more tactics, just in my own exploration, I'll share a few thoughts. Thinking about a name that isn't too like clouded with fog of other projects. I would encourage you to look for the name hard versus hoping it doesn't exist. And that includes YouTube and some of the video aspects that can be a part of this kind of podcast experience. And so thinking about a name that is unique that you can build around long term. And then another, this is a little bit more tech, but this is something that I think is good to articulate. Having your podcast hosted in a central place. There's libsyn.com. There's podbean.com. There's a handful of these like primary locations where this is where the show notes live. This is where your artwork lives. This is where the actual MP3 lives. And then you use these centralized tools to link to, for instance, Apple Podcasts, Spotify, all the different popular podcast platforms that people use to listen to it. And so it's hosted in one place, but distributed many.
Yeah. Let me ask you a question. Did you go back and forth on if you wanted to use a paid host or a free host? Was that a hard thing that you had to go through? Or
it wasn't too hard of a thought because it was inexpensive. I mean, it
It's
was
super cheap.
based off the size of how much files you were going to use per month.
Yeah.
And even early on, I went from like $12 a month to $20 a month because we're uploading a lot of content. But if you're just doing one show, 2 shows a month, like it's an easy $0 to like $15 a month type investment.
Yeah. The biggest thing, because for a lot of people, and I do still encourage this, is if you're on the fence to use a free host. But I started out with a paid host because I wanted to own my content. I wanted to make sure, because if you go to anybody's show notes or description of an episode that uses a free platform, it says that platform, like, that has their logo on your stuff. It has their email. I just didn't want that. I wanted to have my own.
Yeah. I mean, it's worth a small investment, to make something you're proud of, which will, I think, add momentum into whatever direction you're building. And then, making sure that it's a sequence launch, having a pile of them so that it's not like frantic.
Yeah.
Oh my goodness, I have to create a new episode for next week. That's going to burn out fast. And so making sure that you have the reality of personal bandwidth to tackle this more longer term experiment. Those are a couple of things that come to mind. And lastly, for me, and then Corey, I'll let you wrap this, we'll shift topics, but thinking of this as another piece of a creative puzzle. I don't quite know what it looks like, but I know that I have, remarkable people willing to share their insight, and it connects to, in my case, weekly writings, an NFT project, BenBot, so thinking of it as another piece of your career portfolio.
That is so real. And I love that you said that, because I was going to say a lot of people, these are some of the questions that I get. How do you make money off your podcast?
Don't worry about that.
And I'm like, I don't make money off of my podcast. I make money because of my podcast, right? My podcast
I love that sentence.
I've made a few dollars from sponsorships, nothing to write home about.
Yeah.
But that's not the goal.
Right.
You know what I mean? The goal is to have great conversations, which let me do My City, My Health, the conference, which let me do Coffee Can't Fix Everything, which give me that thought leadership in health equity. That's how I get it.
I love it. Well, hit Corey and I up if you have more questions about how to start a podcast. But you just heard him mention My City, My Health. What a perfect segue from a fellow podcast host knowing how to manage our time. But let's talk a little bit about that initiative, my friend. Did it start with the podcast, or did it start in a different way?
It started because of the podcast.
Nice.
So it was this was right around the time that I had recently hit 182 in the U.S. medicine category. And I was
I might have to title this show 182 at this point,
Just saying, 182.
What a flex.
And I was like, what's the next move for the healthy project?
I'm going to get to 183 and not be able to break through. Continue.
183 is still a big deal. Hey, for real.
Continue.
And I was like, what's the next step? How can I build off this momentum of having this great platform? And I was speaking with my guy, Larry Twitty, who helps me run My City, My Health. And he was like, you should do the Healthy Project Conference. And I'm like, okay, I like that idea. Long story short, it went from the Healthy Project Conference to My City, My Health, which the goal is to have health equity conversations in every major city in the country and to utilize the thought leaders in that city. So instead of bringing in a great speaker from Nebraska to come speak about Des Moines, let's have people in Des Moines speak about Des Moines. Let's have people in Nebraska speak about Nebraska. You know what I mean? And it's very intimate. It's set up like 4 separate podcasts. You know, I have 3 panelists, a moderator, and we just have different conversations where everybody is able to listen. So there's not any breakout rooms. It's just one stage, 4 conversations.
So one of the things that I'm excited about is the timeliness of this episode.
Yeah.
You have an upcoming version of this for our Des Moines and Iowa regional audience.
Yeah.
Talk a little bit more about what's to come.
Yeah, so this is our second My City, My Health in Des Moines. We had our very first last year, and it was just a vibe. It was so great at Mainframe Studios, and we're running it back, you know.
mycity.health
Yes.
is the place to be.
Yep. You go to mycity.health. It gives you a lot more information about My City, My Health, the conference series that we're putting on. Anybody that wants to participate or even want to have a My City, My Health conversation in their city, they can go there and see what that's about.
One of the things that I assume is happening is the uniqueness of the location and the conversations that lean into the complexity of that environment. And yet there's probably some similarities between different locations that can be applied so that we're kind of snowballing this educational experience.
Yes. So that's what's so cool about this is, so last year we had our first Des Moines. We had My City, My Health, Iowa City in April. Similar conversations, different conversation, same topics, totally different conversation. And it was so interesting to see how different people came at the same problem, different solutions.
My hope is that folks will almost like travel with the initiative, knowing that like creates roots and awareness that can be brought back home and continue to be nurtured no matter where they're coming from.
Yeah, that's the goal. That's the goal, man.
That's cool, dude. That's cool. Well, know that that's coming up. And usually we don't talk dates on this show, but I wanted to put this into a timely schedule. What are we looking at for the next event here in Des Moines?
Next November 17th at Mainframe Studios.
Nice. Take a peek and know that that's going to nourish no matter how you play a part in that health equity conversation. You know, as we start to close down, my friend, I know that you've interacted with a lot of different people through this topic.
Yeah.
And so I'm curious if you might be able to share a couple of like mental fitness tips, insight that you've been able to learn from in all of these different interactions.
Yeah. So one thing I think that, Ben, you'd appreciate, and you kind of said it, earlier in the beginning of the episode, is building a community, right? Like we can't, not only can you not go through building a business by yourself or whatever the case may be, you can't go through life by yourself, right? Life gets hard. Life be lifing. Right.
I say entrepreneurship is a community sport, but I might have to broaden it and just say life is a community sport, right?
Yeah. So when, finding those people that you trust, finding those people that you can say, hey, I'm not feeling the best today, and being able to just feed off of that energy, you need that. That's the most important thing.
Well, and feeding off of it, but feeding others.
Yes. Oh, my gosh.
Right?
Yes.
And we talk about how generosity builds trust, right? So if you're in an environment where you have the privilege of giving back, right? Giving first, knowing that, building a network before you need it.
Yeah.
Once that engaged network is in place and it continues to evolve, if you're ever in need, you have people that care about you.
Yeah. And so that's for me, that's the biggest thing. That's my first go-to. If I'm having one of those days, my go-to is my community first, right? Because that's where I go. The second thing I would say as far as, mental exercises is either writing or talking, right? A lot of people like to journal. Journaling is a big one. One that I've been doing lately is just going right to my iPhone memo and just talking it out with myself, right? Just getting it out somehow. Because just, one of my whys is being a father. Like, I don't want to bring that energy to my kids, if I'm feeling a type of way. So whatever frustration, whatever I got to do, I'll just talk it out. You know what I mean? Or write it out. So that's a big one.
Reading helps us understand the world. Writing helps us understand ourselves.
That part.
And perhaps we include talking.
Yeah.
It's a form of expression, whether it's writing, whether it's personal journaling, or shipping it as art to those you seek to serve, and then talking with peers in safe spaces, publicly.
Yeah.
One of the things that I remember talking with a friend about is how you get to these like community environments and you have folks that are very talkative. They have a lot to share. They're full. Right?
Right.
And it can almost be numbing when you have someone that has so much thought or has so much to share. And it can kind of fracture a relationship if you're not willing to actively listen. And so knowing that talking is healthy, but that over talking, creates issue. Know that writing, even though it's going through a renaissance with AI, is a healthy addition to your practice. Whether you decide to ship it, whether you decide to, push through the fear and deliver it in a public way or not, that is a way that you can actually talk less when you're interacting with someone who needs to be heard.
Right. And it's such a big world out there. Whatever you're going through, I guarantee someone else is going through it too. So you can find your community through that, and you can help someone else with your struggles.
Right. Well, Corey, this has been such a treat. I knew it would be a good time. And listeners, my friends, I hope you've enjoyed this conversation around health equity, around starting a podcast. Boy, we even talked about the nourishment of adding writing and thoughtful talk into your daily practice. As we close down, my friend, what's a good way for people to stay connected with Corey Lewis? And then why don't you finish us off with that mic drop moment?
Yeah. So, you can reach me at Corey Dion Lewis on LinkedIn. I'm heavy on LinkedIn. That's where my audience is at. So heavy on LinkedIn, Corey Dion Lewis on Instagram, Corey Dion Lewis everywhere. Everywhere. Just type that in. We'll be there, and I would love to connect with anybody that's wanting to connect with me. You know what I mean? That mic drop moment, man. I've been looking forward to this, and now that it's here, I'm like, man, what's that mic drop moment for me? And I think what comes to mind right now is, sometimes you got to give yourself a pat on the back, and with perseverance and knowing where you're going through. And what I would say is flip it to somebody else who's ever listening, who's ever wanting to start that podcast, who's ever going through a struggle. Perseverance is important, and you got it. But you got to find that community. And once you do that, sky's the limit.
Thanks for tuning in to another episode of You Don't Need This Podcast. We hope you enjoyed this weekly dose of innovative energy. Thanks to all who make this show possible. Be sure to smash that subscribe button, and I'd love to learn more about what you're building. Hit me up over at benmcdougal.com, and until next time, may the best of your todays be the worst of your tomorrows. Keep building.